Surgery performed on the wrong patient by Team 14.
Hello, Miss Smith. How are you? You alright? I'm Natalie. I'm your surgeon. You remember we talked a little bit earlier about your knee replacement going on today? And then this is Leslie. She's going to be the nurse helping me. Does that sound good? Okay, so what I have here is your consent. You know how we talked about that earlier when I told you about your surgery? How we're going to work on your left knee. We're going to replace it. Remember?
Oh, it's all blurry.
Okay, well I know we talked about it, so if you want to just go ahead and sign this, we can go ahead and get you prepped for surgery.
I noticed that her armband looks a little tattered. Should we do anything about that? I can go get her a new one.
No, I talked to her earlier. Her name's Jane Smith. We talked about it, and her family was here before, so we're fine.
Okay.
Do you want to just go ahead and sign for me?
Fine.
Yep, this is just your consent. It's just a little form. Not a big deal. Alright. We will come back a little bit later, and I will see you in surgery.
Can we get you anything else right now? All right, we'll be back. You ready to perform our timeout?
I don't think I have time. I know who she is, and I've talked to her a couple times. I'm just going to go ahead and get started.
Okay.
Alright. Hello!
Hi,
How are you all?
we're good.
Good. I am Dr. Harrison. I did Miss Smith's knee replacement surgery this afternoon.
Her what?
Her knee replacement on her left knee. Let's look at it. Oh, it looks great. They did the dressing and everything like I asked them to.
Is something wrong?
Yes. She came in for a hernia repair, not a knee replacement.
What did you say her name was again?
What did you think her name was?
Jane Smith?
No, this
No.
is Maureen Smith.
Her name is Maureen. She was supposed to have
We should have gotten a new
hernia
band earlier.
repair.
She told me her name was Jane, so I just trusted her.
Well, she's
she-
been confused for a couple of
She
days.
has. How did this happen? She has dementia.
Okay. Well, that's my fault. Let me talk to my supervisor since I've never had this happen before. She does have a brand new knee on the bright side, so.
I mean, what do we do?
with
What do we? I mean, what do we do about this? Where do we go from here?
I'm not sure, so let me talk to my superior and we can try and figure something out for you. Hello, Mrs. Smith. How are you?
Good.
Good. I'm Dr. Harrison. I was in here to speak with you earlier. Do you remember? Okay, good. So we're here to do your consent for your hernia repair, okay?
Yeah, I remember.
Okay, good. Has she taken any pain medicine or anything?
Nope.
Okay. And could you just verify your name for me
Maureen Smith,
and your date of birth?
21389.
Okay, and I'm just going to check your armband and make sure. All right. So 502-974-1507, and that's what I have on my armband. Perfect. So how are you feeling about your surgery?
I'm ready.
You're ready? Okay, good. So I know we talked about what it was and the risks and everything. You're okay with that, right?
Mm-hmm.
Okay. So if you just want to go ahead and sign for me.
This right here?
Yep.
Thanks for coming back so early.
Of course. Do you have any questions for either myself or Leslie about the surgery or what's going to happen before or after?
You can tell me everything.
All right, perfect. Well, I will see you at surgery.
Now, off to the OR for Mrs. Smith's hernia repair.
Are you ready to perform our timeout?
Yes.
Our patient is Maureen Smith. Date of birth is 2/13/89. Our MAR is 502-974-1507. Our procedure is a left lower quadrant hernia repair. Our site is marked. Our patient is Sue Pine. We have all equipment necessary. Patient has no known drug allergies. She is not on any anticoagulants. She is not on any herbal supplements, and all other meds have been stopped 2 weeks prior. Are we clear?
Yep. All right, I'm going to go ahead and get started.
The problem. It is difficult to determine exactly how many cases of incorrect patient procedures occur due to the fact that in many cases they are not coded independently of other similar mistakes. In spite of this difficulty, it can be estimated that 30% of hospitalized patients experience an adverse event and many are suspected to occur during perioperative care. Furthermore, multiple community hospitals claimed there was an estimated rate of 20 incorrect surgeries per 100,000 surgical cases. So, while data may change from source to source, there is enough evidence available to demonstrate that there is a problem in perioperative management related to the surgical procedures being performed on the wrong patient. So what's the solution? The timeout. Since the root of surgical errors lies in a lack of communication, the timeout was created to make a planned pause before every invasive procedure. Timeouts have also been incorporated into surgical safety checklists. The timeout protocol has 3 steps as follows. Number 1, perform a preoperative verification process, ideally with the patient awake, aware, and involved. Number 2, mark the operative site to unambiguously identify the intended procedure site. And finally, number 3, the entire operating team takes a timeout immediately before starting the procedure to conduct a final verification of the correct patient, procedure, site, and, as applicable, implants. In spite of all that, there can still be further improvement. Although the timeouts have been proven to improve post-op and surgical safety, the low incidence of wrong patient errors makes it difficult to identify a single intervention that can reduce the amount of wrong patient errors. An additional problem that has been noted is lack of participation among surgical team members who might be unfamiliar, rushed, or simply distracted during the timeout.